Welcome to the LongCovidPodcast with me, Jackie Baxter. I am really excited to bring you today's episode. Please do check out the links in the show notes where you can find the podcast website, social media and support group, as well as a link to buy me a coffee if you are able. You should not rely on any medical information contained in this podcast and related materials in making medical, health-related or other decisions. Please do consult a doctor or other health professional. I love to hear from you. If you've got any suggestions or feedback or just want to say hey, then please do get in touch. I really hope you enjoy this episode, so here we go. Hello and welcome to this episode of the Long COVID podcast. I am delighted to be joined today by Professor Nisreen Alwan, who is a professor and researcher from the University of Southampton. She also has long COVID, so there's lots of fascinating stuff up for discussion today. So welcome to the podcast.
Thank you so much, Jackie. I'm really glad to be chatting to you today.
So it's wonderful to have you here. To begin with, would you mind just giving a little introduction to yourself?
Yes, sure. So I'm a public health doctor and also a public health academic and researcher. So I do research in the area of public health. You know, I focused a lot on kind of maternal and child health in my research before COVID, and also around kind of what shapes health problems later in life. How can we prevent them really early? Also looking at health inequalities, what shapes people's, behaviors and environment in relation to health. So, yeah, I'm based at the University of Southampton. That's my job. And then I'm also a mother. I've got 3 children.
Amazing. That sounds like a really full life.
So I just stopped at the hobbies bit because, to be completely honest, I don't have time. I don't have time to do anything else. People would say, "Oh, and I enjoy doing this and that." Like, I just work and look after the children.
Oh, amazing. So would you be happy just kind of talking us through your experiences with COVID and, unfortunately, of course, long COVID as well?
Yeah, sure. So I got COVID in March 2020. So the first wave where I didn't get a test because I didn't go to hospital. I was one of the people who just had it at home, just started just a few days before the UK went into lockdown. I was working very, very hard. I think during that period, I was working the hardest I've ever worked in my life. We were working on COVID because as a public health doctor, we kind of all focused on this. So we're doing stuff on COVID and in relation to kind of the public health response, etc. So I was working from home, but I was working hard, and I had these symptoms, and I think I got them from one of my kids who also were briefly symptomatic about 3 days before me. Obviously, the main message was that if you're of a certain age and you don't have major underlying conditions, it's just going to be a kind of a brief flu-like illness, if anything. And so it didn't really feel that severe to start with the first couple of days, and it kind of got worse, and it didn't really feel like a flu-like, illness to me, having had flu many times before. But I never got to the stage where I thought I need to go to the hospital in terms of severity. And even in that kind of first 2 weeks, the fluctuating pattern started to get established, which again is quite different from my experience of having flu. You don't get that sort of, I think I'm getting better, and then next day you back to shivering and kind of pains and etc. So that felt quite strange to me, but I kind of just carried on, keep calm, carry on. And that pattern kind of continued after then, in terms of it was, in the first 2 weeks, remembering I might have had the temperature maybe on and off more than 2 weeks. But even beyond that, the other symptoms that I had just kept coming and going. And then some new symptoms started developing, like palpitations. Later, more kind of symptoms around kind of fuzziness, brain fog. That came actually much later. So that's how it happened. I kept thinking it's going to get better. It didn't get better. And I think what really saved me in that period is that people on social media saying they were experiencing the same. People were baffled by it. I mean, I had many colleagues, doctors, health professionals who were trying to get back to work and having experiencing this and struggling with that. And I think that kept me going in a sense that I thought it's not just me imagining all of this. This is happening and it's happening to other people as well.
Yeah, and it just didn't go away.
Yeah, it didn't go away. I had to take a period of time off sick in summer 2020. As I said, I worked really hard before that, and I always keep going back and wondering whether if I've really rested at that period, whether the course of the recurring illness that kept coming over the following two years or so, would have changed. I would never know that, but I definitely didn't rest in the sense that I was definitely mentally, I didn't rest. Obviously, we were in lockdown, so there's not much you could do physically, but mentally I didn't rest. And then over the following months, physically, I tried to push myself as well, as many other people with long COVID did. So yes, and then it kept coming and going. Then lately, really, I think the relapses have become much more spaced out. And in between, I am achieving, I think, some level of normality. It is really hard because you become very cautious in terms of what you're doing, because with all the experience of the 2.5 years, you start thinking, oh, I better not do this. Oh, I better do this carefully. I better, so you really start to calibrate yourself. And I think that's one of the aspects that's really hard to measure about complete recovery from long COVID. It's very hard to tell people to disregard all of the experience that you've accumulated around what could trigger your symptoms. So you start kind of building your activities and life around it. So I definitely can't tell you I've completely recovered. I am functioning at a much better level than I was before on the whole, except where I would have some, relapse period in between. But I've maintained work for the majority of time, perhaps at the expense of other aspects of my life to try and maintain that. Yeah.
Yeah, I mean, that's obviously wonderful to hear that things are a lot better than they were and that you're able to work. So that's really great. But I think that's a very good point. There are a lot of people who are struggling to work because they have no other choice. But, it is at the expense of their health and certainly at the expense of their quality of life. You hear people saying that they work, they struggle their way through a day at work, and then they come home and they basically just pass out for like 15 hours and then they push themselves through it the next day. And it's really heartbreaking to hear when people are having to do that.
Yeah, that's right. Exactly. I think work does become, to me, really, it was work and obviously caring, as a kind of a parent as well. And those were the priorities. And I just tried to kind of build things around them. I often wonder, because for most of the time with my work as an academic, it was working from home. More and more now, obviously, we're kind of going back to going and teaching and things. But I think particularly during that first year, if I was actually physically going to work, I think it's very likely that I wouldn't have been able to maintain that. I think that it helped that I was doing it from home. It was flexible. At one point, for many months, actually, I've adapted. I've had the laptop. I lay on the sofa. I've adapted a workstation around me, just laying and putting my leg up. One of my main symptoms were actually leg pain. And that seemed to be common, with other people as well. And also that sort of feeling of chest heaviness, the palpitations. The posture made a difference to me, like how I'm sitting. If I was just sitting like that, I couldn't maintain it. So I had to adapt all of that. Obviously, I could do it at home. I wouldn't have been able to do it at work, just lying on the sofa and working and kind of having made some adjustments to where I am. So I think these things help.
We'll be right back. I'm interrupting myself for a second to tell you about long COVID breathing. The fabulous Vicky Jones and I have teamed up to bring you long COVID breathing. We are both passionate about sharing our expertise and experience of the breath and how incredibly helpful that can be with long COVID. We've worked together to develop a course that is specifically tailored to those with long COVID. It's a 6-week course with 12 sessions, all delivered online. The community feel and learning that we're all sharing is such a joy. To find out more information and to sign up for our courses, workshops and other shorter sessions, please check out the link below, longcovidbreathing.com, or email longcovidbreathing@gmail.com to start your breathing journey with us. Yeah, definitely. That's a really good point, actually, because at that point, everybody was working from home unless you were a doctor in a hospital. Well, actually, there were other people as well, weren't they? But,
Yeah.
the majority of people certainly were at home. I mean, as a public health doctor, this pandemic and the fallout from it, I guess is your area.
Mm,
And I was watching your TED talk, which I will put in the show notes because it's fantastic.
thank you.
And you mentioned that you sort of had doubts about this if you're young and healthy, you'll be fine mantra from the start. And I guess this is from your area of study that you could see that. Not sure about that.
Yeah, I mean, I think definitely I did right from the start, only because there are so many viruses that can produce chronic health effects. And this was a new virus. And I felt it very strange that we were being very firmly reassured that it's only about this acute phase and it's only about if you get severe illness in the first week or 2 weeks. And I thought, well, how do you know that? Because it's not like no other viruses can do that. We know that several other viruses can do that. So I think definitely it was just very absent from the messaging that this is a possibility at all. I mean, remember in these early days, there was this talk about the herd immunity and that if you get it once and that's it, you get it over with, it's all finished. Obviously, we now know this is all not true. But even at the time, I thought, how do you know that? Again, it's a new virus and viruses would behave differently in terms of how long immunity lasts and everything.
Yeah, of course. I mean, how could you possibly know with a virus that's only been around for a couple of months?
I mean, at the time, I knew viruses cause chronic ill effects. Some viruses go on like hepatitis and cause things like cancer, etc. The actual more kind of the typical presentation of a post-viral illness, of a maybe less well-defined post-viral illness, I was much less familiar with. I have to admit, I was quite ignorant about it, as most doctors are, I think, because you're not really taught this, or people don't focus on it in much detail. And then the more you know about it, once this happened, once I've experienced long COVID, the more you know about it, you think, that was something that we should have definitely expected. But we need to know more about post-viral illness in general. We know little about it. So you become more aware of it. But I think even if you don't have that knowledge, and also around ME and CFS and things like that, I didn't really have good knowledge about it. But even if you don't, it's basic knowledge, I think, for everybody who maybe works in health or has some sort of medical education, that viruses can cause chronic health effects. And that should have been an obvious possibility from the start.
Yeah, I mean, it's really interesting, isn't it? I mean, I obviously am not in any way a medical professional, but I had a couple of friends with ME that I knew, before COVID came along. And, I thought I sort of understood it, but, in hindsight, I really didn't.
Yeah.
But I guess we were all maybe a little bit naive, I don't know, and thinking, oh, well, we've been told we'll be fine. So, why wouldn't we believe that? But you're right, post-viral illness has been around for
Mm-hmm.
a very long time, and this has kind of opened my eyes to how ignored it's been and how little has been invested in it, which actually is awful, isn't it?
It is. And once I went public with long COVID and started to talk about it, I've had several people I know personally come to me and say, we've had we've had this virus in the past, and we've had this illness for like 2 or 3 years after. And it was really a struggle, and we understand and identify. And I didn't know these people are new, and I, perhaps not very well, but I knew through different networks, and I didn't know. And I think people, even people who struggled with post-viral illness before the pandemic, didn't quite, understood there's quite a lot of awareness. And people would come to me and say, well, we just, we used to go to the doctor and they didn't know what to do, and it was just kind of something that we had to manage and take time. So I think a lot of people have experienced that before. It's just that collective storytelling about what's happening perhaps came a bit more together with long COVID, because we had this pandemic and loads of people getting infected at the same time.
Yeah, it's the sheer number of people
Yeah.
that it has happened to all at the same time, I guess, isn't it? That's made, I was going to say, a bit more of an impact. I'm not sure if that's quite the right way, but I really do hope that it will shine a bit more of a light on this sort of condition that has just been ignored for decades. I mean, you mentioned social media earlier when you were talking about your experiences, and I think social media often gets kind of vilified, doesn't it? And maybe rightly so in some perspectives. But what are your experiences of kind of finding community and support in these spaces? Because it's certainly been huge for me.
Yes, I mean, I mentioned Lifesaver in the early stages because people were putting out their accounts about what they're going through, and particularly around that sort of fluctuating nature of long. It was really weird to me because, I haven't experienced that before, and it was just it wasn't, I mean, reassuring is the wrong word because you're not reassured that you're experiencing this, but at least you're not experiencing it alone, it's not just using. So I think that played a big part because you couldn't even have the words to describe it properly. And I don't think I did, perhaps maybe at the very early stages, because I was just articulating long COVID is difficult. And I think some words have become mainstream, like fatigue and brain fog and post-exertional malaise or post-exertional symptom exacerbation. Actually, at the start, people who weren't familiar with them, it was hard to articulate it. I mean, one of the main symptoms I had was this feeling, it's like this thing, it's like just sitting on my chest. I wouldn't describe it as chest pain, but it was like this heavy feeling. And I remember one of the things, in social media, people would describe it as like a small cat sitting on your chest. And I thought, yes, that's exactly it. That's how I feel. And I think these were very helpful, the description of these symptoms. And actually, this is not specific to long COVID. I think we tend to lazily label things so that others understand. So, and a typical example is fatigue, right? You just label these feelings that you have, which is about the kind of the energy that you have, or maybe the pain that you have in your body. You kind of label a whole load of collective way of feeling in different parts of your body under the small word of fatigue, but you do it because you want people to understand, you want to communicate, you want to say, I'm experiencing this, that others have experienced as well, so please help me. But actually, a lot of these things, I think, we could do much better kind of describing the symptoms themselves. And I think that a lot of that came out in social media where, people didn't necessarily immediately labeled their symptoms with kind of common labels and describe them. And that was really helpful. So obviously then I became more kind of vocal about it. So I'm talking about, in summer 2020, I started kind of writing articles about it and talking more about it. And I think then you see the other uglier side of social media where there are a lot of people who are trying to kind of, I think, just didn't like, me saying that or others, talking about long COVID in the context of COVID. And then you had all the negative kind of comments, and I mean the kind of trolling and the abusive and the really rude comments and all of that, they're quite destructive and they can really get to you. And obviously that if they're threats as well, and that's really kind of serious, but you kind of start learning how to deal with them, blocking people, etc. But I think the more hurtful ones are the ones where, the more kind of passive aggressive sort of interactions that you can have, more of the discrediting or gaslighting sort of comments. And I did touch on that in my TED talk a bit about that sort of position of being a scientist and a public health doctor and somebody living with the condition as well, and how that can be labeled as you being biased, by experiencing illness. And I think that did affect me definitely a lot in the first year, but it got better as well. So I think social media is just like most other things in life, double-edged sword. And I think it's about you kind of setting boundaries and managing it as what suits you, really.
Yeah, absolutely. And I've definitely noticed it. It's one of those things that can really suck you in, isn't it? I think Twitter is probably the worst for it. And it's like you can just scroll and scroll and scroll, and you can see all these people who are saying really interesting things or really awful things where you want to, post a message of support or something or to try and help. And then, before you realize it, you've been sort of scrolling Twitter for an hour and a half and you're exhausted and you've taken on all of this stuff on top of your own stuff as well. So I've definitely needed to kind of be quite careful to not get too sucked in and to make sure I gave myself breaks from it as well.
Yeah.
But yeah, it's definitely, huge benefits from it as well. And then it was actually really interesting. You just touched on the personal versus the professional side of having long COVID, but also being involved in the public healthness of what you do. And should you not be more valuable for having experience of both sides of it? So what have your experiences of that been like?
I think having long COVID and trying to understand the condition, and then obviously later on I started doing and designing some research around it, just really changed completely my perspective in terms of how, if you've experienced the position, you can inform, the questions that you ask research, the approach that you take. I mean, we've been trained to have patient participation and kind of designing research, but I think I didn't realize how vital, I think, it's fair to say, it is right from the start, because sometimes you start the process too late. So that you design your questions and you think, this is what I need to know. Oh, this is what my message. And then you kind of say, oh, let's involve, patients at this stage. And I think it should be right from the start in terms of coming up with the questions, what's important to know. So I think it's changed my approach a lot. And looking at long COVID, because I experienced that, I saw it as a strength. But obviously, I was aware that people were seeing this as bias, as a weakness, that you once have the condition that you might not be able to kind of think straight about the science because you're influenced. And yeah, I think that's wrong. And I think it comes from the false kind of concept that you're somehow 100% objective if you've not experienced a certain condition like long COVID. So if you've not experienced long COVID, that is an experience in itself. If you're talking about long COVID, you don't know what it's like, or you've experienced COVID and you've recovered completely. That is an experience. And then you've got long COVID. That's it's an equivalent thing. And I think we just need to kind of always take that into account. So I think it's fair that I always say, and that's why I've said from the start, I've experienced it. And I try very carefully not to generalize my experience. We know the long COVID experience is so varied. I know I've been very lucky in that I've been really on the mild end of the spectrum of it. So I try very hard not to generalize, what happened to me. But it just gives you an understanding. I mean, if you've experienced something around it, I think it gives you a deeper understanding. And then you would also connect a bit more effectively, I think, with people who may have different experiences, to bring people together. So I think we need a culture shift. I mean, again, once I started speaking about this kind of this false bias versus objectivity, some people reach out to me, like PhD students, saying we've started doing PhD because we've experienced or a relative experience this condition, but we can't really say that because that might be perceived as kind of influencing our research. So we try not kind of to shut it out from presenting the research finding. And I think that's wrong. I think it enriches things. And I think people shouldn't be ashamed about doing it. Certainly shouldn't be disadvantaged, And I think these are the things I touched on that affected me at first, and that sort of image, the concept of objectivity, and you're kind of not achieving that. And I think I've become more confident in challenging that now. So I think it needs to be taught everywhere, definitely in medical schools. It needs to be taught. It needs to be taught in any sort of scientific training that this is not a weakness or a bias, this is a strength. Yes, it could influence what you're doing professionally, but that's the point. You want it to influence what you're doing professionally. But I do think it is fair that perhaps if you are doing something that would influence a lot of people and designing, to say, actually, I've had this experience and that might have influenced. And then if more people do this, it will become normalized and it will be seen as an advantage, I think.
We'll be right back. Hey there, I'm just jumping in for a second to see if you're enjoying this episode. If you're finding it useful, maybe you would consider sharing it somewhere, a friend, a group, or even on your Twitter feed. If everyone was able to share just once, we'd be able to get this information out to even more people who really, really need it. So please consider sharing somewhere if you possibly can. I hope you enjoy the episode, and thank you so much. Yeah, because I think anybody, whatever their experience, is going to have some form of
Yeah.
influence on what they are doing. So whether it's an experience of long COVID, or I don't know, not long COVID, like you said, or literally anything else, be it race or gender or, any of these things where people have different experiences, so it's like, what is the quote unquote normal standard kind of person? It's like that sort of person doesn't exist, do they?
No, and I think that's something that science should be very wary of, to kind of project that, well, science is objective. Well, but scientists are human, isn't it? And every single human is affected by their experiences, by their life experiences, the people around, they integrate all of these experiences. And I think it's naive really to pretend that scientists are different. And what we've done in science is that we've got the system where you declare your interest. And it's been so far mainly around financial interest. So if you get funded by a drug company to research certain drugs, then you need to kind of disclose that. And obviously, it's a very tricky situation. So if you extend it beyond these things, then, well, where do you stop? You could write 3 pages on every scientific paper saying, oh, this is my life. And actually, there are researchers who can do this, where they kind of report their findings and they say, well, actually, I've interpreted from these findings from this point of view, this is where I am. It is a big ask, and most scientists would not want to kind of go into that much detail in terms of their personal life doing that. So I think there's a conversation to be had about, and maybe there's a way of agreeing these things, but until we get there, I think it would be fair to ask people to say, well, nobody's really truly objective. We're all human. We're all influenced by things. And if some experience that you've had is informing you about, because you've lived that experience, why is that a bad thing?
Yeah, exactly. Is this not why studies and stuff is sort of peer reviewed and other people are involved? It's not just one person. So is that not supposed to kind of level out any potential biases, isn't it?
It is, but again, I mean, the peer review is kind of mainly from a scientific methods point of view. You've done things correctly, and from a scientific methods point of view. So you could have a whole paper where the research question is asked in a way that really would not benefit the patients, and that could pass the peer review process, because the peer review is really about, okay, well, you've asked the question, how have you designed your study? Is that appropriate in terms of design, etc.? So yeah. And I think for me, really, it has been a process, because you are going through these things. And I think sometimes, I mean, I got involved in the long COVID community right from the start in terms of research. I'm quite kind of reserved about what I say about what's reported as advancement in research, or any kind of suggested treatments or anything like that, perhaps more than many other people long COVID. It's because I'm applying all of that training in terms of looking critically at things all the time. So I think it is good that you have both of these, and I don't think you lose them just because you have long COVID. I mean, it is undermining to think, or just because you've experienced that condition, you kind of lose all of the stuff that you know already, and you just, you become very biased into kind of thinking of one direction or another.
Yeah, exactly. You're still a professional. You still have that knowledge and all of those experiences from before you were ill. You've not suddenly just become completely stupid.
Yeah, it's an additional thing that informs you, enriches, it's not a good thing to have, but it enriches your experience. I've learned so much in the last 2 years, 2.5 years, really, just really enriched by that experience and the interactions I've had around it. And I guess for lots of people, they've had long COVID, it's terrible, but they're kind of then maybe, presented challenges that made them kind of know themselves more, or know other people more, or kind of go in different directions, I guess, like you have as well, doing this podcast. So I guess, these are silver linings, and it's impressive. It's impressive how kind of lots of people with long COVID, and I guess that might apply to other conditions as well, have gone in those direction. And the activist approach for people with long COVID has been immensely impressive, I think. And I think that's because, I think, going back to your social media question, I think social media did play a big part in this, because it brought people together. Otherwise, it's difficult to do that.
Yeah, and something that underlines, the kind of the whole long COVID chronic illness experience is this feeling of isolation and being cut off from who you were before and other people. And social media does give you that, doesn't it? It
Yeah.
brings people together.
Yeah.
Are you able to chat a little bit about the research that you've been involved in for long COVID?
Yeah, I mean, late 2020, we had a survey. We designed a survey to just look at long COVID, really. I think it was one of the first surveys because it wasn't particularly resourced. We were kind of doing it on top of other things that we're doing. It took a while for us to report the findings, but it was over 2,500 people were surveyed, majority from the UK, but some from other parts of the world. And I think we looked at the symptoms, but also looked at the pattern, in terms of that fluctuating episodic nature. We kind of described that. We looked at the triggers, what people thought triggered their symptoms in terms of physical, and mental exertion, stress. I mean, I think stress maybe is something which is really less talked about. Maybe I'm digressing a bit, but I think that's an important finding. But because I think certainly my experience, stress triggers my symptoms sometimes, and then I get stressed about being stressed, if that makes sense, because I know it triggers my symptoms. And I think, it is a common trigger, but because of that harmful narrative of, oh, long COVID is in your head, people kind of talk less about this because they don't want to give the opportunity for others to label them as, well, you're just stressed, so you're imagining you've got long COVID. It's not like that. But I think, because we know stress triggers all sorts of other physical relapses of other physical illnesses, that's a known thing in terms of its kind of biological mechanisms, etc. So anyway, I think that's something which probably we need to talk about a bit more, because it's very much related to life, to work, to all sorts of other factors that could help maybe people manage long COVID a bit better. So yeah, we did the survey, and then that one of the main findings actually were that we asked people whether they think they've had adequate rest in the first 2 weeks, and everybody in the survey had long COVID, but we managed to kind of describe two clusters, and there was a minority of the sample who had much more severe long COVID, and it looked like it's getting worse with time. And the people who had more severe kind of long COVID with more symptoms, not getting better, more body systems involved, they were more likely to describe that they didn't have adequate rest in the first 2 weeks of the illness. I don't think there's much stronger evidence about rest. I mean, seems to be now a kind of a common sense advice. Rest, when you get long COVID, it's very hard to establish definitive evidence, but this is something that we kind of found in the study. And then what we did a year later is go back to the same people and ask them to tell us how they are now. We kind of looked more at kind of the recovery. How does that look like? Because very few people describe themselves as recovered. And I think, again, the recovery is really an under-researched area, because you've got that bit where I think at the start, a lot of people were describing themselves as recovered, and maybe if you go back to them now, they might say something like me, where like we're functioning and we're working, but maybe not sure we're completely recovered. And it's something that needs to be characterized a bit more. But we also looked at stigma. So my colleague Maria Pantelic, I worked with her, and she led a component of that survey, which is like a stigma scale, to ask people whether they felt stigmatized, and that included whether they felt other people discriminated against them, but also include things like them not internalizing stigma, so them not reaching out about their illness because they're kind of judging themselves for having it. But also there's a bit which is anticipated stigma, which is you don't want to go to your GP because you're feeling the GP is judging you as you're just making this up, so you don't go in the first place, you don't seek help. So there's all these dimensions that we've described as well. And then I've been involved in really I've been focused more lately on kind of the inequalities of long COVID. So who actually gets diagnosis, who's more likely to get care, is it following the pattern that we know that people are more disadvantaged, and perhaps people from more deprived areas and people from ethnic minorities, are they getting the care that they need? I mean, we've got some evidence telling us that it's less common in ethnic minorities, but actually I don't think that is correct. I think it's about identification and description of long COVID. It kind of doesn't make sense that we know people from ethnic minorities are much more likely to have the infection, and certain ethnic minorities more likely to have severe COVID. And then you say, well, they're less likely to have long COVID. There's something there about kind of the identification. So I'm working on that, on those aspects. And part of that is part of the Stimulate ICP study, which is a big study looking at different types of treatments for long COVID and different types of kind of investigations and scanning. And I'm working on the inequalities side of it.
That sounds really fascinating. And yeah, it's very interesting what you were saying about the sort of incidence of long COVID in ethnic minorities. There was somebody that I was talking to who was saying about education about long COVID, because a lot of people just across the board actually, will be complaining about symptoms largely following a COVID infection. And then when someone says, that sounds a bit like long COVID, and they'll go,
Yeah.
oh,
Yeah.
so it's sort of like this education angle of where people have obviously heard of long COVID, but it's like, oh, it couldn't happen to me, and there's obviously something missing there.
Yeah, and that's what we're trying to do, that by kind of doing a study where we're reaching out in the community and saying, have you got these symptoms after, say, 3 months from COVID? You could have long COVID. We want to talk to you, because exactly it's about reaching out. But I think, again, I mean, the jury's out. We still have to do the research. But my hunch is more than education. It's a bit about labeling as well. And because of the press that long COVID had, I think some people might not want to be labeled with long COVID. It might be too stigmatizing, and particularly if you're disadvantaged and kind of automatically more likely to be disbelieved about things, you might want another label for your illness other than long COVID, because of all the kind of, I would call it a political drama really around long COVID, because that's what it is. It's always linked in people's mind with the restrictions. I mean, it is fascinating on social media that you talk about long COVID and somebody comes and says, oh, you just want to lock us all down again or something. So there's this kind of association. I think the media is responsible for a lot of that as well, in terms of, that association, because, well, nobody's talking about lockdowns anymore. This is something of the past, Yeah, I think it's just, there's a lot of factors shaping how people react to that label of long COVID. And maybe people don't want that extra burden, even if they're not well. I am definitely a proponent, and I've always been, we've done articles with Elisa Perigo, who kind of initially came up with the term, and we did some pieces in 2020 about why we need to continue using this term. It's a patient-made term, and it's really kind of doesn't make assumptions, like post-COVID syndrome, for example. There are sometimes some of these names have assumptions. So I'm all for using long COVID, but I think it's fair to say that we need to look at how people react to having that label. Is there some disadvantage carried from having that label to people? And we need to look at that and research that as well.
Yeah, definitely. Yeah. So what are your thoughts on kind of where we should go from here? Things like health measures and protections, or, well, anything, I guess.
Well, I think we need to learn, really. And it's very disappointing to see the lack of learning from this awful pandemic. And I think things that we've learned, things around how masks can be really useful in certain settings, how clean air quality is good for us, not just from a COVID point of view, but from all sorts of other airborne viruses, and maybe future ones as well. I mean, we could have another pandemic, another airborne virus could come up, and if we have the systems to deal with it, then we'll be better prepared. Where is all of that learning going? It's very frustrating. People are so keen to just back to normal. I mean, there's no such thing as back to normal, in my opinion. We've gone through experience, we've learned, and things progress and move on. And I think there's this bit about, we need to do things exactly the way we did them in 2019. That is not realistic. Whether we had the pandemic or not, that just doesn't happen. Things move on. So I think that's frustrating to see. And I think change will happen, but it probably will be slow. I mean, when I get frustrated about these things, I read about history of things about like the uptake of vaccinations or uptake of sort of certain hygiene measures, and that we now take for granted. Things, even public health measures like seat belts, for example, everybody just happily, when they say, oh, we can't wear masks for life. Well, you're wearing seat belts for life. I'm not saying you wear masks for life, but it is something that you can use. It's a tool that you can use if you need to use it, that if it reduces your risk and other people's risk. It's not an evil thing. It's just a public health tool that you can use it as needed and when it's effective. So I think, with public health, you look back in history and think what we're experiencing is not unusual. All interventions had lots of resistance when they start being implemented. So that kind of gives me a bit of hope. But I think we need to learn so that we're better prepared if there's another pandemic. But also, COVID is still happening. Other flus happening, other viruses happening. Why not apply what we've learned to prevention of disease?
Yeah, I read something about someone comparing air quality and water quality, and we don't dispute the fact that clean water is absolutely 100% vital to our health. But as soon as you start talking about air quality, then suddenly you're a conspiracy theorist, or you want a lockdown.
Yeah,
it's really interesting, isn't it?
It is interesting, and it's very hard to disentangle. Almost everybody went through a very hard time in the pandemic. Some people, much harder than others, even if they didn't experience long COVID. I think with, just kind of the lockdown, the employment aspect, the isolation, businesses going, anyway, lots of it. And I think that's something, again, I've noticed is people have become very judgmental, I think, and it's kind of like black and white, and they're like, it's like a war, and maybe you see that exaggerated in social media as well. And I think people have gone through a difficult time. So I think lots of people react in a way that maybe reflects the difficult experiences they've had. And I think it's good if we always remind ourselves, if we want change, we need to keep putting out those kind of positive messages about why we need change, how we change, and not get drawn too much into kind of wars, and divisions about who's right and who's wrong, and all that sort of aggressive way of clashing that you see a lot on social media. So I think it's been a difficult time. But going back to long COVID, I mean, some media headlines are really very frustrating about, oh, is it real? That sort of thing. It's not helpful. And it's just there for the clicks, really, because there's some form of denial around long COVID. It might give some sort of short-term relief for some people. And I think that the media can feed on that. Not all of it. It's better now. It's more accepted now, isn't it? But you still get these sort of messages.
Yeah, and it's so triggering, isn't it, when you see that?
Yeah, and we don't have to interact with it or read it, I guess. I think the way people with long COVID have been amazing, community with long COVID, is they've been very positive. In even kind of my area, which is public health or prevention. I mean, I've seen public health messages about prevention, which are amazing, and perhaps more than I've seen from some public health agencies. So I think it's about that kind of maintaining the direction and where you want to go and the positivity, rather than being drawn into kind of this factions, fighting each other, etc. Because I don't see this going anywhere. And people do get on board on things, and I think that's what history teaches us in terms of public health. I mean, with long COVID, I feel like I'm a broken record because I'm saying the same thing over and over again, but I think that is needed, to kind of reinforce the message that this is a risk and we need to do our best to try and reduce it as much as possible. And I mean, vaccines, obviously, we know that the risk is reduced with vaccines, so that's really good news. But I think the message should also be that long COVID risk is not completely eliminated by vaccine. We know this so far. So what else could we do to try and minimize the risk?
Yeah, it's like sort of lots of little things that help. One thing on its own is not going to do the trick, but that's good to, change is happening. It will happen, however slowly.
I think so. I think it's inevitable. It is inevitable that change will happen, I think. But it's frustrating for us, and because watching this in real time, I guess.
Yeah, absolutely. Yeah. Well, thank you so much for chatting with me today. It's been an absolute pleasure listening to you speak. So thank you so much for giving up your time and everything else that you're doing as well. And of course, all the best with your recovery as well.
Thank you so much. Same to you, Jackie. It's been such a pleasure to have this conversation. Thank you.
Thank you so much to all of my guests and to you for listening. I hope you've enjoyed it, or at least found it useful. The Long COVID podcast is entirely self-produced and self-funded. I'm doing all of this myself. If you're able to, please go to buymeacoffee.com/LongCovidPod to help me cover the costs of hosting the podcast. Please look out for the next episode of the Long COVID podcast. It's available on all the usual podcast hosting things. And do get in touch and